So psychiatric psychotherapy in comparison to clinical psychology is basically delivered by a psychiatrist. So it is a trained medical doctor, a trained psychiatrist who's delivering a form of psychotherapy. There's a variety of forms of psychotherapy that we deliver at Sloan Court Clinic. So we've got some psychiatrists to deliver psychodynamic therapy. There are other psychiatrists like myself who deliver a cognitive behavioral therapy and schema therapy. There's others that may use interpersonal therapy. So psychiatrists have learned certain therapies and they're delivering that in conjunction with their psychiatric input. Now, in comparison to our clinical psychology colleagues, the advantage may be that, for example, medication and psychotherapy can be managed in one hand. Clinical psychologists are not allowed to prescribe. Psychiatrists are allowed to prescribe. So we've got this overlap where people that come with a lot of complexity and perhaps pre-existing medication can be seen psychotherapeutically by a doctor who can manage both. That can be an advantage for a lot of conditions. For example, for people with bipolar disorder or for people with complex trauma that are already on medication, it can be of advantage by being managed by a psychiatrist. The other advantage is when you've got very complex comorbid or pre-existing physical conditions. That means people come with perhaps severe respiratory problems, or they come with cardiac problems. They might have panic around their cardiac problems. And it's good to have a doctor who knows also what they may be worried about. So if somebody, for example, has a panic disorder around what if I get a heart attack, and they might have had even a pre-existing heart condition, even though that's not dangerous for them at the time, it will be good for a doctor to know about these conditions and also take them through the cardiac, if you will, the cardiac medical component of that condition. So that can be another advantage.